Hello, and welcome to my lecture. We're going to be going over antivirals today, antiviral medications, alright? And so these drugs, antiviral medications, they're going to primarily affect DNA synthesis. And so we have drugs to treat several viruses, and we're going to talk about 7 viruses specifically, alright? So number 1, we're going to be going over influenza. Drugs to treat influenza. Number 2, we're going to be going over HSV, so that's your herpes simplex virus, and then along with that is your varicella zoster virus, also known, abbreviated as VZV. Number 3, we're going to be going over HIV. Number 4, Hep B and C. Number 5, we're going to go over cytomegalovirus, also abbreviated CMV, and then number 6, respiratory syncytial virus, also abbreviated RSV, and then lastly, number 7 is HPV, also known as human papilloma virus. And so the last 3, the cytomegalovirus, respiratory syncytial virus, and then human papilloma virus, those are super quick and easy. The other ones, your influenza, HSV, VCV, HIV, Hep B, and C, those are going to require a little bit more time to go over. And so let's just jump right in. Alright, so influenza drugs, these are going to be divided into 2 groups, alright? That's your amantadine and then your rimantadine. Let me just also preface by saying all the drug names I'll be going over are primarily generic, and so I'll just say the drug names, and those are the generic names. And if I'm going to give you a brand name, I'm going to say this is the brand name, alright? So assume that I'm giving you the generic name. Alright, so that's amantadine, amantadine, rimantadine, and then, so this group of drugs to treat influenza, these are your second-line agents. Why did I give you the second line first? Well, because I just thought it'd be cool. But there's another reason. And then zanamivir and oseltamivir. So zanamivir and then oseltamivir. And oseltamivir, the generic name, that's the generic name. And so the brand name of that is Tamiflu, and that's something you hear all the time. Tamiflu. So Tamiflu, know that brand name. But the reason why I told you the second line agents first before the first line is because if you think the mnemonic for the drug names is ARZO, Arzo. So for me, that just makes so much sense. Arzo, you think of influenza drugs. Oh yeah, Arzo. A for amantadine, and then R for rimantadine, Z for zanamivir, and O for oseltamivir. But more importantly, just be able to recognize the natadine is the ending for influenza drugs, the second-line agents, and then mivir is the ending for the first-line agents. Alright, and so before I tell you anything else about the drugs, you should know that influenza has multiple strains, alright? And so these strains are classified by their core proteins, and so you know how you've heard like influenza A, influenza B, I'm so confused why, they just have different core proteins of the virus, and so that's your A, B, C, and D. Now, A is what causes pandemics, and so beyond being classified by core proteins, influenza can also be classified by species of origin, such as avian or swine, right? Swine flu, we've all heard of that. Well, maybe not, but I've heard of it. It can also be classified, influenza can also be classified by geographic site of location. Alright, so recommendations change year to year for antiviral medications, so it's very important to just stay updated with the CDC and just know that zanamivir and the oseltamivir are your first-line agents. Alright, so let's jump right into zanamivir and oseltamivir. So their mechanism of action, what do you think it might be? So zanamivir and oseltamivir, they interfere with the release of progeny virus from the host cell so that the virus progeny can't spread to other cells. So what does the word progeny mean? Progeny virus. That literally means the the virus from the host cell, right, the big mama, is going to create little versions of itself. So mini viruses. So these are like the little babies, right? And so progeny just literally means children. And so by not being able to spread, its babies to other cells, then it decreases the reproduction of the virus, essentially, which is what we want. So the spectrum of zanamivir and oseltamivir, the first-line agents of influenza, essentially is influenza A and influenza B, all right? And so the use of zanamivir and oseltamivir, it's used as prophylaxis and also as treatment. So prophylactically, we're going to use oseltamivir and zanamivir in your high-risk patients. And there are 6 main ones that you need to know. And so the mnemonic is, if I can remember it, it's CIA, so CIA, and PEG, so PEG. All right, and so CIA stands for, what does that stand for? CIA. So that's going to stand for COPD patients, your immunocompromised patients, and your asthma patients, so CIA. All right, then you have PEG, all right? So P for pregnant people, for pregnant ladies, E for your elderly, and G for, okay. All right, I mixed something up. So PEG. So we have PEDS patients. We also have pregnants and elderly. So actually, the mnemonic is PEP, not PEG. So PEP, because that totally makes sense. Oh, you can think POP. Let's do that. CIA POP. So you have, your POP is actually part of the CIA. So CIA, so C for COPD, I for immunocompromised, A for asthma, P is for your pregnant ladies, O is for, instead of elderly, we'll call them old people, and then, or your geriatric population, but just think old. And then P is for your PEDS patients, so young kids. These patients, 6 patient groups, right? Your CIA POP patient groups are at high risk of influenza, so you really want to make sure you give them prophylactically zanamivir and oseltamivir. All right, and so when you have exposure to the influenza, then you want to give this dose daily to prevent the disease, and it actually decreases the risk by 70%. Another example of prophylactic use is if you want to treat the family prophylactically, like one of the brothers has the flu, but the other siblings don't, and so you really want to make sure you give that family and all the other siblings, as well as the parents, the zanamivir and oseltamivir. All right, and so beyond prophylaxis, we also have the second way to give zanamivir and oseltamivir is to treat the infection. All right, and so zanamivir is and oseltamivir. So we want to treat the infection, right? And so when a patient presents with severe flu signs and symptoms, right, within 72 hours, you give these drugs. If you give it after the 72-hour window, sorry. Okay. Okay. All right, so now that we've talked about prevention, now we're going to go over the treatment of influenza infection with zanamivir and oseltamivir, all right? And so the most important thing that you need to remember if you're treating influenza infection is to give the drug within 72 hours of the onset of symptoms. What this means is the patient comes to you and it's been 24 plus 24 is 48. 48 plus 24, 48 plus 4. All right, 3 days. So it's been, on Monday, they came in to see you. On Wednesday, they started having flu symptoms. So Wednesday, Thursday, Friday, Saturday, Sunday, and it's Monday. So that's way after 3 days. So if you gave them zanamivir and oseltamivir, it would not be effective. It needs to be within 3 days, within 72 hours, that they have the first symptom that they need to get these drugs in for it to be effective. And what it essentially does, it lessens the severity of it, and it also decreases the time, the number of days you're sick by 1 to 2 days. All right, and so that's for both zanamivir and oseltamivir. So we're going to dive a little deeper. So zanamivir specifically, the administration is it's inhalation only. So it's a powder form. And the ADRs that you can get with this is 1, a cough bronchospasm because it's a powder form. Number 2, a reversible decrease in pulmonary function. So that's the good thing is it's reversible. And then 3, you might get nose and throat discomfort, but it's not permanent, it's just transient. And then the main contraindication to know about zanamivir is that you don't want to use this product because it's a powder in asthma and COPD patients. So instead you'd give Tamiflu, also known as oseltamivir, Tamiflu being the brand name, in the patient groups with COPD and asthma. And so oseltamivir is given orally. It is a liquid, and so just know that the ADRs are nausea, vomiting, abdominal pain, typical headache, fatigue, and diarrhea also can happen. This does increase the risk of seizures, so you just need to be very, very cautious and monitor the patients if they do get seizures. So oseltamivir, probably the biggest ADR is risk of seizures. And with their nausea, taking the drug with food may help the nausea symptoms. All right, that concludes influenza. We're going to move on to HSV, herpes simplex virus, and varicella zoster virus. All right, so your drugs for HSV and VZV are divided into PO and your topical drugs. All right, and so your PO medications are all going to end in clovir. All right, acyclovir, valacyclovir, famiciclovir. All right, and so the only one I want to point out specifically that's different than the other two are acyclovir is IV, PO, and topical. All right, but while valacyclovir and famiciclovir are just PO. And then your strictly topical medications are peniciclovir, dococinol, and then trifluridine, and the mnemonic for that is DTP. So, think a dark TP, right? Because the TP, back then they didn't really have electricity or lights, so then it was really, really dark back then. So D for dococinol, T for trifluridine, and then P for peniciclovir. All right, so what is the mechanism of action for acyclovir? All right, so acyclovir, it's going to inhibit DNA synthesis, and in turn, the virus-infected cell cannot replicate, so it's interrupting viral DNA replication essentially. But what's really interesting about acyclovir is that the drug actually first needs to be activated. And so how do you activate this? So actually, it's done by an enzyme, and this enzyme is only found in virus-infected cells. So human cells, none of their enzymes will activate this drug, only if you have it virus-infected cells. So cells infected by a virus, they produce an enzyme that will activate acyclovir. All right, so HSV of the genitalia. So we're going to talk a little bit about the use of acyclovir, and it's divided into when you're giving acyclovir in the first episode of HSV of the genitalia, and then for current episodes. All right, so if you're giving it for the first episode of herpes, essentially it can actually shorten the duration of onset, shorten the duration of symptoms by 2 days. But you can also give acyclovir for recurrent episodes, like if there's acute flares, then it can also shorten the symptoms by 1 to 2 days as well. All right, so excuse me, I was wrong. not just 2, but in addition to the first episode, recurrent episodes, you can also give long-term suppressive doses, and so smaller doses are given daily, and this is for if you have multiple recurrent episodes, you're getting them all the time, and essentially by giving a long-term suppressive low dose daily, then you can reduce recurrence hopefully, and then also reduce asymptomatic shedding as well as decreased rate of sexual transmission of herpes simplex virus. Alright, so topical acyclovir. The thing to know about topical acyclovir is that it's less effective than the PO form for primary herpes simplex virus, and there's actually no benefit in treating recurrent genital herpes. So, I mean, just hearing that topical is not as effective as the oral form, so obviously use the oral form for genital herpes, and then so that's just a no-brainer. All right, so varicella-zoster virus. So this is also important to do to administer this administer the drug for VZV within 72 hours. If used within 72 hours of shingle or acute zoster, the drugs for VZV will actually decrease duration and total number of lesions as well as post-herpetic neuralgia. But if you pass the 72-hour mark, then it really decreases effectiveness of the drug. So you just want to, it's not as worth it to do that. All right, so what are the ADRs of acyclovir? So they're pretty mild and there's not that many. Nausea, diarrhea, and headache. It's generally well tolerated. Just know, yeah, pretty much is well tolerated. Just know that if you have an active episode, HSV, VZV, HSV or VZV, you will want to give smaller doses and more doses. Longer treatment versus suppression or higher dose. Alright. Well, why don't you just forget the last tidbit I said, because I don't know what I'm trying to say. Alright, and there's 2 other HSV, VZV agents. That's your valacyclovir that I want to mention, and famciclovir. And so famciclovir is pretty much the same as acyclovir. You know, it's a PO drug. And then the valacyclovir, that's converted to acyclovir by first pass metabolism, and you get higher levels than you would see with acyclovir, and so it might treat zoster a little bit better, but we're not positive. But essentially, it's the same as acyclovir. There's actually one pro that you'd want to use valacyclovir, and that pro is that you only use it 1 time a day for prophylactic use versus acyclovir is a BID drug, so you have to take acyclovir twice a day. So fewer doses is the pro for valacyclovir. Alright, and the last thing I'm going to talk about for herpes drug is the topical medications. Like we said, it was those DDP, the dark TP, so that's your docosanol, your trifluridine, and then pencyclovir. Alright, and so docosanol, that is over the counter, and you want to start this drug within 12 hours of the prodrome, and then you apply this drug 5 times a day, and you get better 18 hours faster. Alright, so T for trifluridine, it's essentially used for HSV in the eye, so it's also known as keratitis. And what's interesting about this one is, if you know the brand name, it will help you out a lot, because the brand name is called Viroptic, which makes sense because trifluridine is actually used for the eye, HSV of the eye. Alright, so optic is within the name, it gives it all away. Lastly, P for dark TP, pencyclovir. That's an active metabolite of famciclovir for genital herpes, and so you have to apply this within 1 hour of the prodrome, and then you continue every 2 hours while you're awake for 4 days total, and then you get better 18 hours faster. And so just like knowing about these 3 options, it sounds like docosanol is probably the best bet, because it just seems like you applied a lot less 5 times a day versus pencyclovir. You have to apply it like every 2 hours while you're awake, which is way more than 5. Yeah. Alright, so that concludes that concludes our lecture about influenza drugs. So we're going to move on to HIV, and I'm going to do this as efficiently as possible. We're doing so great. Alright, so HIV. So you're going to want to control the replication of the virus and also keep the viral load low without killing the virus, alright? And so with HIV, you must use combination therapy to 1, decrease the number of replicating viruses, and 2, to prevent resistance, alright? And so this is often a process done by specialists just because it's so complicated and it's really difficult to adhere to. The program is really difficult to adhere to, and there's toxicities associated with the program as well. Alright, so HAART, that's not a mnemonic I made, that's an actual abbreviation of highly active antiretroviral therapy. And so this is a treatment of, we're talking about HIV. We're talking about HIV, that's what we're talking about. And so this method of treatment is suppressive, and so essentially it keeps viral loads down because we're not trying to kill the virus entirely. Alright, so HAART, highly active antiretroviral therapy. It's going to use 3 to 4 drugs from the following groups to control HIV. So there's 4 different groups of drugs, and then you're going to use 3 to, or even just all of them, alright? And so that's your nucleoside reverse transcriptase inhibitor. Number 2, your non-nucleoside reverse transcriptase inhibitor. 3, your protease inhibitor, and 4, your fusion inhibitor. So NNPF, I think it's pretty simple if you just remember NPF, alright? Yes, so non-nucleoside reverse transcriptase inhibitor, and then you have a non-nucleoside. Did I just say that? Well, you have a nucleoside and then a non-nucleoside, then you have protease and fusion inhibitor. Alright, so just know that. Alright, we're going to move on. Look at this, we're moving right along. We're moving on to hepatitis B and hepatitis C. So the difference to know about these two, hepatitis B is a DNA virus, while hepatitis C is an RNA virus. Hepatitis B, DNA, C, RNA. Alright? And so hepatitis B is transmitted parenterally, so IV drug use, needle sticks. It's also transmitted through body fluids, sexual contact, and perinatal, so that means from mother to the child at birth. And so we're going to want to treat active Hep B, but know that it's just suppressive and it's not curative, alright? So there is a vaccine at birth that you can give to patients, to babies, so they don't get Hep B and C, and then it's given at birth, 1 month later, and then 3 months later, alright? And so just like HIV treatment of chronic hepatitis, just like HIV, right, because we're not trying to kill the virus, we're just trying to keep the viral load down, Hep B and C is just the same of treatment of chronic hepatitis. If you have a chronic case of it, then it's suppressive and not curative. So the primary treatment of Hep B is interferon alpha, okay? Interferon, what is that? An injectable cytokine, and it has both antiviral and anti-proliferative actions, all right? Now we're going to talk about Hep C, which is the RNA virus that I told you about. And so Hep C is actually the #1 cause of liver disease and transplants in the U.S. Hep C, you give antiviral treatment if they still have virus in the blood 12 weeks after acute infection. So you're going to want to check their blood before you give them Hep C meds. And the goal for Hep C is to eradicate the virus. Harvoni. So Harvoni is the newest drug you should know for Hep C, and it's effective for patients that are treatment naive. So that means they've never had treatment for Hep C before. The only downside of this is it's extremely expensive. You have to pay an arm and leg for it. The generic names for Harvoni are ledipasvir and sofosbuvir. And so Harvoni, as I said, I mentioned that, or Hep C, you want to eradicate the virus, so it's actually a curative agent and not just suppressive, like just in Hep B is just only suppressive. And so the use of, in addition to Harvoni, you will also give interferon alpha as well, just like in Hep B, and then ribavirin. And that concludes Hep B and Hep C. Alright, we are going to fly through the next three, and let's do this. So, cytomegalovirus. So this occurs in advanced immunosuppression, such as HIV or an organ transplant, and it can cause eye infections such as rhinitis, retinitis, GI such as colitis, and then CNS and lung problems. Okay, so lungs, and that's pneumonitis. So what kind of medications do we have for CMV? So the ending will be OVIR, O-V-I-R, and you have one random one, phoscarnet. So if you know that these drugs for CMV all inhibit viral DNA synthesis. So ganciclovir, valaganisciclovir, phoscarnet, and cidofovir. Alright, respiratory syncytial virus, new virus. It's typically, we have ribavirin, and you're going to give aerosolized version of this, aerosolized ribavirin, to children with severe RSV to reduce the severity of the disease. And it's tolerated pretty well overall, but the only ADR that you need to worry about is bronchial irritation. And the second drug for RSV, respiratory syncytial virus, is palivizumab. Alright, and this is typically used to vaccinate babies when they're born, especially premature ones, because when they're premature, they're at increased risk for RSV, so you need to vaccinate these poor little babies. Alright, and palivizumab, the MAB ending stands for monoclonal antibody, and it's used to prevent RSV in high-risk patients such as premature babies. Last virus, woohoo! So we have human papilloma virus, alright? And so the two drugs you need to know are imiquimod and interferon. Imiquimod is a topical applied to external genital and perianal warts, and you apply 3 times a week, and it washes off in 6 to 10 hours. Interferon can be injected into warts for treatment as well. And that concludes our antiviral lectures. Wonderful. Good luck on your exam.